Hello, my name is Stephen and I am uploading this video because I wanted to give a account of my experiences having recently gone through the process of bariatric surgery, specifically a gastric sleeve. When I was researching online before the operation myself for other patients' experiences, what I found was that the overwhelming of people who having this operation done appeared to be women. And that may not be the case, but maybe my experiences were that the sort of footage I was finding online, and certainly various online blogs, were the women's perspective. So this is perhaps an attempt on my part to redress the balance, having gone through the process as a chap. I wanted to give my experiences in the hope that this may help and inform some of you who may be going through a similar set of circumstances. So I'm going to talk a little bit about my background, history, issues with weight loss, and how I came to consider the operation as an option. And I'm then going to talk about the gastric band versus the gastric sleeve and that debate that I went through myself. I'm then going to talk a little about the weight loss I've experienced so far, the pre-operation diet, the liver shrinkage. I'll then talk about the operation day, what I experienced, what I went through, just practical things that you might need to consider. Talk a little about the anaesthetic, the general anaesthesia that you have to have, because I've never had one before. Then I'm going to talk about the post-op care in hospital, then at home, the diet that you're on, the recovery period, and my experiences, how I've sort of felt. So today's date is the 22nd of July 2014. I had my operation on Monday the 9th of June. So we're about 6 or 7 weeks out from the operation. When I went into hospital, I weighed 27 stone and 10 pounds. I did actually weigh a little bit more prior to that, but the liver shrinkage brought my weight down. So on operation day, I was 27 stone and 10 pounds, which is 388 pounds. My current weight, as of today's date, this morning, is 24 stone and 9 pounds. 24 stone 9 pounds. Have this written down, which is 345 pounds. So that's a total weight loss of 43 pounds, just under 3 stone in 6 weeks, 6 or 7 weeks, which I'm really pleased with. So talk a little bit about my experiences. Why did I do this? What brought me to this point to have surgery, bariatric surgery? I have always had issues with my weight. I was a stocky child. I did play sports, and that sort of kept any excessive weight gain in check. But what happened for me was at university I stopped playing sports, and I didn't have a great diet, and a combination of that with then getting a sedentary desk-based job meant I wasn't having a very active lifestyle. So over the last, say, 10 to 12 years, I've slowly put on a lot of weight, probably about a stone a year, until I found myself at the point, maybe 18 months ago, where I was getting close to 30 stone. And I think whenever you're getting 30 stone or approaching 30 stone, you're at a point where it's socially unacceptable. It's difficult to do many things. It's difficult to get in and out of cars. It's difficult to be mobile. People, point and stare at you, so it's uncomfortable as well. So I wasn't in a good place. I wasn't happy. I wasn't happy with my body. I wasn't happy with how it was making me feel, and it was affecting my health. So I went to the GP to talk about weight loss options, and I've said in the past I have tried diet and exercise, which is the typical response you always hear. You want to lose weight, diet and exercise. It's a no-brainer. There comes a point when you're so large, certainly when you're getting close to 30 stone, exercise is very difficult. I have a job in the city where I have to commute a few hours a day, and by the time I get home in the evening and I've had some food, it's very difficult to even get up out the sofa. So the idea of spending even half hour, 45 minutes doing gentle cardio, it's nearly impossible. So I'd got myself in this trap where it was difficult to exercise, and whilst I could diet and take some weight off, it wasn't a marked improvement or any significant weight loss. It was a few pounds here and then, which I would eventually put back on. So I needed something permanent. that was going to take the weight off and keep the weight off. My GP initially put me on something called Orlistat, which wasn't very effective. I was on that for a few months, and then he referred me to a weight loss program at the local gym, where I had to go along to a group and follow a diet and have some exercise. It was sort of supervised exercise in the gym. Did that for 6 to 8 weeks. Again, with varying results. I lost some weight on it, but it wasn't significant. And the reason I had to do this is my GP has to be seen to explore alternative weight loss strategies before they can consider bariatric surgery. And he was sort of fully briefing me as to that as well. And he was quite aware of the fact that these strategies probably weren't going to work, but to get the funding from your primary care trust, you need to try the drugs and you need to try the conventional means. I had a BMI over 50. He was concerned about other health issues. I was getting chest pains, which turned out to be gastric rather than cardiac, which was positive. I didn't have type 2 diabetes, but he was worried about it. Sleep apnea, hypertension, blood pressure. All these things could be alleviated and improved by, drastic weight loss. So he felt the best approach for that was bariatric surgery, and the gastric band was something that he discussed with me, and he said there are other options, but the gastric band was what he recommended me and referred me to a clinic, a local surgeon, and who I met with a few times, the surgeon, once I was approved for the surgery, and that took a little bit. I had to write a letter, I remember, to a local primary care trust because the funding was declined initially, but we got there eventually, and it was persistence and badgering a little bit that paid off. But once the funding was in place for the surgery, I'd met the surgeon. You're given a weight loss target. I think for me it was about 5 kilograms they wanted me to lose. I don't know what that is in pounds, sorry. And that took a bit of time as well, because the reason you're having the surgery is because you're struggling to lose weight by conventional means, and then they want you to lose weight for the surgery. So it's a little bit chicken and egg, but I think I took most of that weight off, but it took a while. It took maybe a year to 18 months. And the good thing about that was the surgery wasn't rushed into. I had lots of time to do research, to meet other people who had the operation, to look online. And part of the process of doing that made me realise that perhaps the gastric band wasn't the most appropriate form of surgery for me. The things I didn't like about the band was that you would have to have follow-up appointments, usually every couple of months. And I know they became more infrequent, but you have to get the band adjusted, inflating and deflating the port with saline, making sure that it doesn't slip or there's no blockages causing reflux. I travel quite a lot. Over maybe 2 or 3 times a year I'll go overseas, and part of doing that, if you have a gastric band, is you have to make sure that there's always a hospital or a clinic overseas where you're going to be staying that can deal with gastric bands, because if you're in another country and the band slips or there's an issue with it or complication, you need to know that they can work on it straight away. And some patients, I was aware, would even travel with their hypodermic needles or syringes used for inflating or deflating the saline. That really didn't appeal to me at all. What I wanted was surgery which I could go in and have, and then maybe the minimal amount of sort of post-op care. I don't want to be going back into hospital every couple of months. I want to get on with my life, lose the weight, and then try and live as normal, a healthy life as possible. So the idea of having this thing permanently there on your stomach for the rest of your life, always having to inflate or deflate it, the risk of it slipping or causing, issues with your stomach, and having to travel places, always make sure, didn't really appeal to me. There is another form of surgery called the gastric. Oh, the other thing on the lap band, the gastric band, is I found out that in some cases it's only effective up to 40% your excess weight will come off. I know it's varying degrees of success, but typically the average weight loss was up to 40%, whereas the sleeve was 50, sometimes even 60% of your excess weight. And there's a third form of surgery known as the gastric bypass, which is up to 70% of your excess weight. That's probably the most effective strategy. The problem with the bypass is it's a 4-hour operation. They're rewiring, for want of a better phrase, your internal plumbing. They're taking your top of your intestines and putting it halfway up your stomach, and it's a malnourishing procedure, meaning that you're not getting enough vitamins, and so you would have to take vitamin supplements for the rest of your life. And so the idea of taking a pill for the rest of my life, again, didn't appeal to me. I wanted to go back to normal, and the band meant I couldn't quite go back to normal, although it was low risk, it was reversible. That's what appealed to me initially, and you could have it done in a day or sometimes overnight. The bypass was a bit more serious, well, a lot more serious, 4 hours, maybe 3 or 4 days in hospital, having to take pills forever. And that left this third option, the gastric sleeve, which when I found out about it initially, what it was, I was quite perturbed, because what's happening is with the gastric sleeve, you're having 75% of your stomach removed, what's called the greater curvature, the whole bottom of your stomach removed, and what they leave is a sort of small tube-like stomach, possibly the sort of shape of a banana, though not quite that big, and that becomes your stomach. And it's not something that's irreversible. They can't put back what they've taken away. But the positives are that you don't have to take pills, you don't have to go back to the hospital and have something adjusted or reinflated. That becomes your stomach. And unlike the band, which makes you feel fuller faster because it creates a pouch at the top of your stomach, the advantage to the sleeve over the band is that, as well as causing a restriction to your stomach, meaning you can eat less, the part of your stomach that they remove produces a hormone called ghrelin, and ghrelin is what makes you feel hungry. So there are two things that the sleeve does that helps you achieve the weight loss. It's a restriction, so you can eat less and feel fuller faster, and you feel less hungry. And for me, part of my weight gain was I would feel hungry quite a lot. I'd get hunger pangs, and I was a comfort eater or a volume eater. So not having the urge to eat food, and then when I did eat food, massively restricting the amount of food I could eat, was something that seemed quite appealing. And it was performed under keyhole surgery, so that was an advantage as well. So after quite a bit of deliberations, discussions with my family and with the clinical staff, I decided that the gastric sleeve was what I wanted. My dietitian was actually pushing me for the gastric bypass, but that's something I did resist. And she sort of put this challenge to me, like, well, I want you to prove me wrong. I want you to prove that you can make this work for you. And so far, I am proving that it can work, because I've lost nearly 3 stone with the gastric sleeve. It's how far I can go with it. That's the thing. 3 stone is not the end of it. I want to lose quite a lot more weight, possibly even as much as 10, but we'll see how far we get. So that's a little bit about me, my background, my journey up to the point where I had the operation, and why I decided on the sleeve over the band or the bypass. As I said, I've now lost 2 stone and 11 pounds, which is shy of 3 stone, and I'm very happy with the weight loss at the pace it's coming off. It's a measured pace, it's not very fast or rapid. It was quite quick to start with. I think the first week I may have lost even 6 pounds, and within a few weeks it was a stone. But now it's a much more sort of controlled pace. We're averaging maybe 2 or 3 pounds a week, and if I can do that for the next year or two, that would be wonderful, and that will certainly help me achieve my own target that I've set myself. So let's think a bit about where we are and the operation itself. So I went in, as I said, on Monday the 9th of June. Before you go in for the operation, and I think this is the case for whatever operation you have, bariatric surgery wise, you have to have what's called a liver shrinkage diet. So that's a diet that you go on for 2 weeks prior to the operation. So I started mine in early May of this year. And the liver shrinkage diet is, well, for my primary care trust, my local NHS trust, I had 4 options. And the first 3 were effectively liquid only. The first one had some food. And you couldn't sort of chop and change midday, so you picked an option and then you finished that option for the day. And it really consists of things like milk, and that's low-fat or semi-skim milk, a few pints a day, yogurts, and those are the sort of Muller Light, 99-calorie yogurts, low-fat, low-sugar yogurts, or soup, and those are the Be Good to Yourself or Weight Watchers type soups, very low-fat, low-sugar. And that's pretty much it for the 3 options that are liquid only. It's a combination of those. One of them is milk only, one of them is milk and yogurts, one of them is yogurts and soup with a little bit of milk. And by day 4 of that 2-week diet, I'd hit what long distance runners might call the wall. I was really struggling with it. I'm used to eating food. Like I said, I'm a volume eater, and I probably get quite a lot of comfort from eating as well. So by the 4th day, where I was just surviving on yogurts and soup and milk and water, and you can have low-fat jelly. That's the other thing. The jelly is literally the only food you can eat. I was really, feeling quite down. And you make your friends and family and people around you aware of that you're going to probably get quite ratty, and you do, and you don't it's nothing too dramatic, but it does affect your mood, and you have to deal with it how best you can. Once you've got past that wall, so for me it was probably by the weekend, it's okay. You sort of get used to it. You get into a rhythm, and your mind starts to turn to the operation, because you're then into sort of single digits. It's 5 days, it's 4 days, it's 3 days, and you're thinking about the operation. And the one thing the liver shrinkage diet does do is it prepares you for the operation, the diet post-operation, post-op, because you're not eating very much food or drinking very much at all. So psychologically, you're preparing your body for the fact that when you come out of the surgery, you're not going to be eating a lot. Had I been eating normally up until the operation, it would have been even more disastrous. So there's a real gradual step change into where you're going. The reason you have the liver shrinkage diet is, as the name suggests, you need to bring down the size of your liver, which sits sort of over the top of your stomach, for them to perform the operation by keyhole surgery, which are small incisions they make. Everything's done with these almost like tentacles or like poles that they put into your stomach. They need to have your liver out of the way. Your liver sort of sits in front of your stomach, and it's quite, if you're an overweight person such as myself, your liver will be quite fatty and large. So they need to shrink that out of the way, and they can clamp it back. If you haven't shrank it enough, there's a risk that they may have to not be able to perform the operation by keyhole, and they effectively have to open you up. That's not a risk that you want to take. So you follow the liver shrinkage diet. I didn't cheat, and I was very sort of proud of that. It takes discipline, and you have to focus on what your goals are and your objectives, and just see where you want to be. But it is hard. That was probably the toughest thing of the whole process that I've gone through, that journey, the liver shrinkage, that 2-week journey. But like I say, after the 4th or 5th day, when you hit that wall, it sort of it gets okay after that. In fact, by the end of the liver shrinkage diet, I wasn't even feeling that I had to eat the full amount of food allocated to me. But what you're doing is you're starving your liver. So it is a malnourishing diet, and you have to take vitamin pills because of that. It's not something you can do for a very long time, so that's why it does affect your mood. But it's important they shrink the liver down so they can get it in a good size and shape, so they can perform the operation by keyhole surgery. So that's the pre-op diet and my experience on it. Operation day itself, well, for me it was a long time coming. I'd known about the operation for a while, and when I actually got the date in the diary, it was almost a sense of relief. And it was there in the calendar. I always knew it was coming. It was the 9th of June, and I had a 7 a.m. admission time. And I went in with some very close family, and it was just a sense of everything was very calm. I was there in the admissions lounge, and I went in at 7 a.m. and I wasn't even taken down to the surgery till about 9:30. So there was a lot of time just to sit, and you talk to a lot of people. The nurses come and they do a full medical history with you, and I think they've almost got this information before, but they ask you about your height, your weight, they take your blood pressure, they take your temperature. You can't have a cold when you go into hospital, so they need to make sure you're sort of fit and healthy as far as it can be for the operation. You get a sort of band put around your wrist so they know who you are. And then you meet the anaesthetist as well, who will talk to you about the procedure and about your history with anaesthesia, and they do a sort of full medical check. I mistakenly asked my anaesthetist, and I wish I hadn't, what are the chances of me waking up during surgery? And the anaesthetist, who was very professional, said, well, you've clearly done your research, so it has happened. And I'm thinking, I didn't want to hear that. But he said the likelihood of it happening with you is incredibly remote. It will be very rare. It tends to happen more with people who've had quite a lot of anaesthetic before. It tends to happen more in women than men, and perhaps women who are older, maybe after the menopause, and effectively if the anaesthetist decides to walk away during the middle of the operation, which I'm not going to do, he said to me. So because of all those things that don't apply to you, I don't think it's going to happen. So he did put my mind at rest, but it was a bit of a concern when I asked that question, because I'd never had a general anaesthetic before. I think I had something, a dentist surgery once, but it was so minor. I'd never had surgery, so that made me a bit nervous. The thing they do tell you about a complication is, and this is with the surgeon rather than the anaesthetist, if after when they go inside you via making the incisions for keyhole, they look inside and your liver is too big, they will still carry on and do the operation. It just won't be by keyhole. They will make a large incision across the top of your tummy and operate on you via open surgery. And that was a bit of a concern because the recovery period is so much longer if they do it like that, whereas keyhole's quite low risk. And so I said, oh, is there any way that I don't have it done that way? And they said, no, if you're having this operation, we will do the operation if it's via keyhole or open surgery. But we're hoping it will be by keyhole if you follow the diet. So that was something I was a bit worried about, and immediately when I woke up after the operation, that's something I wanted to check, but I'll talk a bit about that later. So after going through all the pre-operation checks and the checklists and the questionnaire they ask you, like I say, it was all very calm. Nothing was rushed, and you're in your dressing gown. So you're in your underwear. They put the hospital robe over you. You're in your slippers because they walk you down to the operating room, and you've got a dressing gown, sort of just cover up your bare backside for modesty. Mainly because the gowns don't fit around bariatric patients. And you're in your slippers because they walk you down. You're not wheeled down. And this is the other crucial thing. You walk into the operating room. I'll talk about that a bit more in a moment. So around about 9:30, I walked down with my family. One of the things you might want to prepare for, if you've never had an operation before, is how emotional it is. And I'm a fairly emotional guy anyway. My emotions are always sort of bubbling up at the surface. I didn't break down or cry or anything, but saying goodbye to your mum at the operating theatre doors as they say goodbye, you don't ever think it's going to be the last time you see your mum, but there's always a risk with surgery, and they're clearly very sort of worried and concerned, parents and family that are there, so they give you a hug and they say goodbye to you, but you've got to try and be quite strong for them. So I was definitely fighting back tears. I didn't let them any go, but that's something I wasn't prepared for. So be prepared for when you say goodbye, when you sort of go off to surgery. It's quite a sort of hits you in the back of the throat. So what happened next? I was taken into like a little ante-room, which is next to the surgery, the operating theatre, where you meet the anaesthetist. Now most people have surgery or general anaesthetic will be put under in that room. That's the last moment they'll be conscious before they wake up in recovery, and then they're wheeled into the operating theatre. For some reason at my hospital, I don't know if this will be the case for yours, I was walked into the operating room. So the little ante-room that you sit on the bed, the nurse who brought you down for the admissions lounge, they're releasing you over to the surgical staff. They scan the sort of barcode that's on your wrist, the tag they put on, and then the anaesthetist puts a little cannula into your wrist. So they've got to find a vein here, which they found quite easily. There was a bit of blood because it sort of comes up a little bit. There's an artery there. If you don't like needles, just don't look. It's really not painful either. Your mind is on the surgery and all the other things, so I wasn't even thinking about it. If you don't look at it, you're not really aware of it. I promise it's not painful as that goes in. It's more painful when you sort of look at it afterwards. You think that's actually going into a vein, but it doesn't hurt, I assure you. So that's the cannula being put in your back of your wrist before you go into the operating room, and they then tell you, we're now going to walk you into the surgery room. So at this point, I left my slippers behind, and they take those back up to the ward wherever you're going to be, and I think my dressing gown as well. So my dressing gown was taken off and I was walked in, and that was the most surreal experience I think of the whole procedure. Walking into an operating theatre, it's a space that most of us will never, if we're not surgeons, be consciously aware of. So you're in an operating theatre, and the bed isn't like a normal hospital bed. It is it's like a large sort of slab-like table that you're on, which they can lower it electronically, and they can move like this. I should say that unlike most procedures that are performed on you under general anaesthetic, bariatric surgery is actually performed like this. They put you at an angle, and they want to bring the organs down, and they use gravity to help. So I was put on the table, and they have these sort of pillows next to you, so your arms are put outstretched. One of the anaesthetists said it's a little bit like being crucified, and I was like, that's the wrong word to use, but thank you. So your arms are out here like this, and you have to spend a bit of time adjusting yourself, because the table is going to be put like that at an angle. They don't want you to fall off, so your feet have to be very, very comfortable and heel to toe on this sort of plank that's at the bottom. And I remember spending a good couple of minutes getting comfortable. They also put on your bottom of your legs, which are exposed because you've only got your pants and a gown on. They put these sort of almost like cushion-like bands around your legs, which have got tubes coming out of them. And when the operation's happening, those inflate and deflate on either side, and that's to stop deep vein thrombosis. So those are put on either side of your legs. They're like just little cushions, paddings. Imagine like shin pads. Those are on either leg at the bottom. So you're then put back into this position, and you're lying there on the operating table, and they wire you up to a ECG monitor, and they've got the pads on you. And the anaesthetist is talking to you, and they're very good at making you feel calm. They're asking you your name, what do you do, what would you normally be doing at this time of day, as calm as you can be when you're lying conscious on an operating table. And you're aware of lots of monitors around you, and you look up and all you can see is one of those big lighting rigs that you see in sort of casualty or ER. You're thinking, God, I'm lying on a hospital table right now. And it was when they wired me up to the ECG machine, I heard one of the anaesthetists say, "Stephen, you're getting excited," because they could see my heart rate rising. And I said, I didn't say it, but I sort of thought that's because I'm lying on a hospital table. So again, some deep breaths, they calmed me down, and it was fine. You've got to just sort of put that out of your mind where you are. I didn't see the surgeon. They were obviously in the other room scrubbing up. There were other people, but I think they were sort of people assisting with the operation. It's mainly the anaesthetist you're talking to, and there's another anaesthetist who's there with you. I wasn't aware of a mask being put over my face, but I think that happens afterwards. So the anaesthetic, that's what happens next. I've never had a general anaesthetic before. I may have had one when I was very, very young, but I don't really remember it, and it was at a dentist surgery. But this is the first time I'd ever had a general anaesthetic for major surgery. And I was a bit worried about that, but it turns out my worries were unfounded because generally it was very pleasant. It's like going for a wonderful, deep, lovely sleep. Imagine you've been up awake for 20 or 24 hours and you finally put your head on the pillow and there's hardly any time at all and you just feel yourself going to sleep. It's like that. It's very, very nice, and it's not sort of sudden or jolty or chemically or painful at all. It's just you just drift off very quickly, and it's a nice feeling. And it comes in 2 stages, the anaesthetic. So they obviously attach it to a cannula, and it's I didn't have any gas. It was by a sort of injection into the cannula, and they tell you that the first part of the anaesthetic will just make you feel drowsy. It won't send you to sleep. And you take a few deep breaths as it goes into your system, and that's exactly how you do feel. You feel like quite euphoric. It's on a high. I don't know what it is that they're giving you, but it does make you feel very good. And you can feel a sort of rush over your head, and everything feels wonderful, groovy almost. And you're like, this is nice. This is a nice feeling. But you're still awake. You haven't gone to sleep at this point. They then probably wait about 30 seconds, and they say, right, we're going to introduce the second anaesthetic now, and this will actually make you go to sleep. And it happens very quickly. And there was no countdown for me. They didn't say we want you to start counting down from 10. They may say that for you. If they were, I wouldn't have gotten past 9 or 8 because it happens really quickly. So the second anaesthetic goes in, and you're aware of it coming. You can sort of feel the tiredness coming quite quickly, and you're thinking, I don't want to fight this. I'm just going to go. But I was aware of before I go complete this sleep, I wanted to say something. Probably because I'm a big mouth and I just like to speak. But I just said just before I went under, good luck. And as I said that, I could hear them sort of laughing. And I felt the anaesthetist sort of tap me here, and he said, it's going to be fine, Stephen, just relax, and we'll see you in recovery. And that made me feel great as well, so I probably went off with a big smile on my face, and that was at 9:45. I went under at 9:45 for the operation, and that's the last thing I remember, lying on the operating table with the pads on my legs, my arms like this, and going to sleep very, very gently and peacefully. It was lovely. That was at 9:45. And this is the strangest thing, actually. The waking up in recovery happens almost immediately. You're not aware of any time having passed. It's the equivalent of time travel. I looked around in the recovery room, and I could see a clock up on a distant wall, and I had to adjust my eyes a little bit, but it was 1:10. So I'd been out for a good few hours. I don't know how long I'd been in the recovery room for after the surgery, probably a little while. And it was 1:10, and that's missing time. Normally if you go to sleep or have a nap for that amount of time, you're consciously aware of the passage of time. There was none of that there. That is missing time that I will never ever get back. My brain was asleep. I don't know what was happening to me. I don't want to know what was happening to me. Well, I do know what was happening, but I wasn't aware of it. I went to sleep at 9:45. I woke up at 1:10, and as far as my brain was concerned, it happened like that, instant. And that was the strangest thing, and it's unlike anything I've ever experienced before. So you wake up in recovery, and the one thing I will say, and they had warned me about this, is clearly when you're under and you're having the operation, they do put a tube down your throat to help you with the breathing. They don't put it down until you're asleep, and it's to assist you with breathing, and gets oxygen into your lungs while they're performing the operation, and that's going down into your windpipe. They don't pull that windpipe out until you're awake, or until you're conscious, and that's something they did pre-warn me about. My eyes weren't open, but I was certainly aware of something being pulled out of my throat, and it wasn't painful, and it wasn't like I need to scream. It was just strange. It was the feeling of something coming from here up and out. It happens very quickly and it's over. And you know, no sooner as it's happened, then you're then being woken up and your eyes are open. And it almost happens when you're in that dreamlike state where you're half asleep and half awake. So I don't even really have a really vivid memory of it. I just conscious, and they told me it was going to happen, so I was slightly conscious of it. But you are aware of them pulling something out your throat as you come around after the operation. And that was before my eyes were open. And you're in recovery, which is a different room. You're in a different part of the hospital, which is again strange. You go to sleep in one room, you wake up in another. So you've been wheeled around, and everything's very drowsy. You know, they've given you some medication to obviously wake up, but the anaesthetic's still in your system, so you're quite drowsy, a little bit sleepy. I wasn't in a great deal of pain, and some people have said after the operation they were in pain. It sometimes feels like a bit like you've been sort of hit in the stomach. I wasn't conscious of any extreme pain. I know some people would even go to the extreme and say they're not even aware they've had an operation. I was aware that I had an operation. I was sore, but I wasn't painful. And if I leant a certain way or moved, I would feel, oh, that hurts a little bit. But it wasn't excruciating, because I don't like pain, you know, like most people. So I was a bit concerned, but you're not in a great deal of pain, probably because of the amount of morphine they give you, because you are on morphine after the operation. There's a nurse by your side constantly in the recovery room, and if she goes away, there's someone else there, so there's always someone with you. And the first thing I wanted to ask, because I was aware of the complications and difficulties they have with liver shrinkage, was have they done the operation by keyhole? I could see in front of me I had two hands, and I could see my feet were still there with the sort of shin pad things they give you. So I knew, you know, they hadn't had to amputate anything, or, you know, not that that would never happen, but these are sort of irrational fears you have. So hands and feet are still there. Good. I'm awake. I'm in hospital. Have they done it by keyhole, or did they open me up? And you can't quite see because you're not, you know, everything's still a bit drowsy or dopey, so you can't even look under your gowns. So I had to ask a nurse, and the word I wanted to say was laparoscopic, but try saying that after an operation when you're drowsy, and the word that came out was it laparoscopic? Was it keyhole? And I got that out eventually, and she sort of was very reassuring. She said, yes, the operation was a complete success, Stephen. The operation was by keyhole, and you're doing fine. And the moment of relief and euphoria at that point is wonderful, because you've come out the other side. Everything you've done has been a success. The operation was positive, and it was by keyhole, which was great. So that means the recovery is going to be even better. So I actually put my head on the pillow and went back to sleep, but they woke me up promptly saying you can't sleep, you need to stay awake. So after about 15 or 20 minutes of being in recovery, they wheel you up to the ward, and the ward that they put you on, or the ward they put me on, is a surgical high dependency unit. It's for people who've just had an operation or are about to have an operation. And if you've got friends or family or relatives coming to visit you, you want to sort of make them aware of that, because a high dependency ward is a little bit like intensive care. So there are nurses always around you. They're constantly looking after you. And the care I got was wonderful, a really, really top-rate care. But it was called the Wren ward I had. I was put into, and the first 4 hours are tough because you're what's called nil by mouth. So I hadn't eaten anything certainly since the evening before, and that would have only been a yogurt or a soup. I hadn't drank anything, I think, from 6 AM that morning. It's now sort of 1, 2 in the afternoon, and I've had a tube down my throat for a few hours, so my throat was parched. It was really dry, and you're trying to create saliva to make it dry, but it doesn't always even come from anywhere. So the only thing they can give you is a sort of something that's the size of a cotton bud with a sponge at the end of it, which they dip in water and they sort of rub it around your lips, and you're not even supposed to drink that. And I was quite hot. It was a very hot day, and so I remember my mum was there, and she sort of put a flannel, a cold flannel on my forehead to keep me cool. They're constantly sort of looking after you. They take your blood pressure, they take your temperature, they're looking at your heart rate constantly, almost every 2 or 3 hours, and they do this through the night as well. So you might not get a full night's sleep on the first night in hospital, but they want to see that you're well and you're recovering. Let me think. Well, so yes, the first 4 hours you're nil by mouth. You don't have any water, and then after 4 hours they give you the tiniest little beaker of water, and you drink it, and it's wonderful. You can drink again, but you can't have another beaker until 2 hours after that, and then it's 2 beakers. Then 2 hours after that you're allowed 3 beakers, and then 2 hours after that you're on free flowing water. But it's just water for the first day, because you need to give your new stomach a chance to heal. So the wounds themselves, the scars are tiny because it's keyhole. I had 5. One of them is particularly large, and that's the one that they bring the part of the stomach out. The rest are probably no more than 1 centimetre. I'll show you one of them. I won't take my shirt off. I'm very embarrassed about these things, but let me have a look. Where is it? There. That's one of my keyhole scars, and it's tiny. That's 6 weeks later. You have bandages on for the first couple of weeks, and they scab up a little bit, but then you take the bandages off, you can shower. I've been swimming, and they're not 100% healed. They're still scars, but they will get better, and they're not particularly unsightly. So there's 5 of them, and one of them has a surgical drain coming out of. I think it's called a Robinson drain. So that's a tube that's right by where they've been operating on you, and it's collecting any excess blood or any bleeding that they didn't pick up in the operation, and it's draining out into a little bag that's outside. And for me it was a safety pin on my dressing gown, and I wasn't aware of that. So it's like a colostomy bag, but mine didn't have a lot of blood in it, but it is draining the blood out from the operation site, and it's a tube that's going into the wound, but it's a plaster down so you don't pull it in. And all the wounds are plastered actually, so you don't even see them. They changed the plasters on my second day in hospital on the Wednesday, so I did see them then. In fact, when they take the Robinson drain out on the Wednesday, that's the day I was discharged, that is a little bit uncomfortable. Fortunately, I'd had, I think, a morphine tablet about an hour before, so that had kicked in, so I think that sort of diminished the pain. But it's more the thought of it, I think, than the actual pain itself, because what they're doing is they're pulling a tube out, and the thing I wasn't expecting is you'd assume there's only that much tube inside, but they pull it and they keep pulling it, so it's quite a long way in there, or it's coiled in there, however they prepare it. So they pull and they pull and they pull, and I was just looking away when they did it. And that was on the Wednesday. So I think day 2 I had a yogurt. They do keep you quite upright and mobile. I went to the toilet on the first day, so I was walking the same day as the operation. They worry a lot about deep vein thrombosis. They want to keep you quite active. If you're really uncomfortable, because you're not in a lot of pain, but it's just more discomfort. And if you lean a certain way, some of the wounds are a little bit painful. But if you're just lying still in bed, it's okay. I think the first night I wasn't able to sleep on my side, so I had to sleep on my back. But they encourage you to get up and use the toilet. If you're really struggling, I still kept mine. You can use one of these, like a little a bed pee pot. So you put your fellow in there, and you're able to sort of pee. That was my souvenir from the hospital. But I only used that a couple of times, and it was more in the middle of the night when I didn't want to walk down the hospital corridor. But they do encourage you to be active, and when I wasn't feeling like lying in bed, there's a table next to you, and so a chair, and you could sit upright. And I did a lot of reading. I took an iPad in, had my iPhone, able to text people. So overwhelmingly positive experience for me. The hospital care I got, they were really, really dutiful in how they looked after me. And by the Wednesday, because I went in on the Monday, I was ready to go home in the afternoon. When you do go home, it's an idea, whoever picks you up, to make sure they bring a pillow with you, because I'm sure they won't do any emergency brakes anyway, but just the motion of the car braking, even just the traffic lights or a roundabout, as you go forward, or the belt, you are aware it's sort of pushing pressure down on your scars or your belly, and that hurts a little bit. But if you have a pillow there, it sort of softens it, and that's something I read online, and it was great advice. So I had a pillow, and that helped a lot. But it was only a 10-minute drive for me, and someone else drove me. You can't drive for the first week because of the anaesthetic. So I was home by the Wednesday, and a lot of sort of bed care. I had someone staying with me for a little while to help me. But by the Thursday or Friday, I was able to sort of get up and walk around myself, make soups, drink, liquids on milk and water. I've got stairs in my house, so I was able to go up and down stairs. Certainly not ready to go back to work, and I think I had. Well, you'd need at least 2 weeks off work. I took 3 weeks because I commute into London, and that's a bit rough and tumble getting on and off buses in the tubes when you've had surgery. So I took the full 3 weeks off, and some of the third week I worked from home on my laptop. But particularly if you've got quite an active outdoors job, you will need 3 weeks, possibly even a month. But by the second week, you're starting to feel a whole lot better, and then you get on to the weight loss. So the weight loss, the first week is, you come out of hospital and you've probably lost almost 4 or 5 pounds just anyway, because you haven't had a lot of food. They've taken part of your stomach away, and that's going to have some weight to it, but not as much as I thought actually. So I think the first week I lost about 6 pounds. The second week may have been 4 or 5. So getting on for a stone within just a couple of weeks, which is phenomenal. And then it slows down, and you're glad it slows down. You don't want it to be too quick. One thing I don't want is excess skin or anything like that. So if it comes off gradually and naturally, you're less likely to get excess skin. And if you can exercise more and stay active and stretch, your skin contracts with it. So I'm quite happy with the pace that's happening now, which is 2 or 3 pounds a week. If I can maintain that for the next year, I'm going to be a very happy man. So after the operation, you're on a strict diet like you are before the operation. For the first 2 weeks, it's liquid only, so almost identical to what you've had for the 2 weeks prior to the operation. But unlike that, where they're trying to shrink your liver and it's low sugar, low fat, they're trying to build you up again after the operation with on the liquid only first stage diet. So my dietitian said she wants me consuming about 50 to 60 grams of protein a day. So it was chicken soup, pureed chicken, Complan, Slim Fast, anything that was high in protein, low in fat, low in sugar, and anything that can sort of be drunk for a straw. So it was, like I say, soups, milks, Complans, Slim Fasts, those sort of things. Nothing really solid at all for the first 2 weeks. I think I might have had one of those jellies, but you're on liquids only. But a different type of liquid to the pre-op liver shrinkage diet. It's trying to build you back up again. After the liquid only diet, you then go on to the pureed food diet, which again lasts for 2 weeks. Every stage is 2 weeks except for the fourth. The pureed food is great because you're back on a food at this point. It's all going through a blender though, and that's anything you can put through a blender. So again, I was mixing existing foods like soups with more chicken. You can have spaghetti bolognese but through a blender, mashed potato through a blender, baked beans through a blender. Again, trying to get this 50 grams of protein a day. And the only sort of incident, if you want to call it that, I've had on the post-op diet was in stage 2 on the spaghetti bolognese that I mentioned. It was the bolognese sauce. And it's about educating yourself and your brain about how much you can now eat. So your brain's used to eating, particularly for me because I'm a volume eater and a comfort eater, my brain likes to clear the plate, and I always had done, and that's part of the reason I'm the size I am. And you have to re-educate your brain. I hardly ever finish a plate now. I'm always leaving food, and I can't finish a meal, and I'm comfortable with that. I know that when I sit down and eat something, I'm not going to finish the plate. And I had some spaghetti bolognese that had been through the puree, and I kept eating, and I thought I could eat more. And my brain was telling me to eat more, but my stomach was obviously full. And it wasn't a large portion, it was sort of a side plate, but it was obviously more than my stomach could handle. And within about 5-10 minutes of finishing it, I had still left some. I was feeling quite queasy, and I went pale, and I sicked it all up. It came out. Luckily I had a sort of bucket nearby. And within 5 or 10 minutes of being sick, I felt a whole lot better. So it happened really, really quickly. The blood comes back, the colour comes back, and I had some water cleared out of my mouth. And that's the only time that's happened. And I think probably it needs to happen to everyone at least once, because it teaches you what you can and cannot do, and it's a great way of learning. So I've taught my brain that when I'm eating, I have to eat very slowly and methodically. You're chewing and enjoying every mouth and every biteful, and then once it's swallowed, imagine consciously the journey of it going down your throat and into your stomach and letting it sit there for a little while before you eat the next bite. Because if you pile it all in within 5 or 10 minutes, you're not giving yourself a chance to feel full. You need to let your stomach feel full and send that signal to the brain that you're full. So it typically takes me about 45 minutes now to finish a meal. If I'm sitting down with friends or anyone else, they will all be finished. When I finish my meal, or the last bite I eat will always be cold, and that's just the reality of it now. So when I eat out now, I tend to always have food off the kids menu, because I can't order anything off the for the adult menu. You won't finish it. If you order it, and you know you're not going to finish it, that's fine. One of the things my NHS Trust did to help me a lot is they gave me this little laminated card. So this is something you show to a waiter or server in a restaurant. It basically tells them you're someone who's had bariatric surgery, and it's reduced the capacity of your stomach, and because of that you can't eat a lot of food. They'll either let you order a smaller portion and reduce the price, or something off the kids menu. To be honest, I haven't had any problems in restaurants. I've said I've ever had an operation, I don't have a big appetite, and they're fine, they don't question it. So you can either have a starter, and that's your main, or you order something off the kids menu, and you probably won't finish that either. You certainly won't ever have 3 courses. But it takes you a long time to eat 1 course, and you need to be aware of when you're drinking as well. Normally I would have a drink when I eat. Now if you're drinking while you're eating, the liquid is filling up your stomach, which means you eat less food, and that's not helpful at all. So I'll usually drink about an hour before the meal and maybe an hour again afterwards, but never with the food, because it fills up your stomach. When you're eating as well, because you're unlikely to be able to finish the meal that's in front of you, the advice my dietitian gave me is that you should always eat the protein part of your food first. So if there's chicken or if there's beef, the meat, eat that first. That's the best thing for you. You then eat the vegetables, then whatever's the fibre, and then it's the the starchy food. But it's the high fat, or if there's some potatoes or the carbs or the pasta, that's what you eat last. So it's about training your body to sort of eat the right type of food first, because if that's all gone, at least when you finish the meal, you've eaten the stuff that's best, that's going to help you in the long term. So all these little things you just need to get used to, and the people around you will get used to as well. And there will come a point in the future where you do sort of return to a semblance of normality, where I'm not saying my portions will ever be larger again, but I may eat a bit quicker, I may have fully trained my brain. But at the moment it takes me half an hour to 45 minutes to finish a meal, because I'm eating slowly, consciously and deliberately. So I'm aware of when I'm full, I will stop, and I will stop eating, so I don't feel sick again. So the stage I'm now at, after stage 2 was the pureed, stage 3 is mashable. Mashable is wonderful when you get to that stage. It's basically anything you can take a fork and put through the prongs of a fork. Mashed potato, cottage cheese, scrambled egg, all the good food that we like. So that was a nice stage to get back onto it, because you feel like you eat proper food again by that stage. And to be honest, by the end of stage 2, the pureed food, I'd kind of stepped over into stage 3, because that's quite a lot of crossover. It is 2 weeks, but I didn't strictly follow that. I think by 10 days into pureed I was onto mashable, and without any discomfort to what I was causing here, because I'm eating everything very slowly and methodically. So if there's something that's going to happen or upset, I'm aware of it first. I can't eat a sandwich anymore. The sandwiches that you buy in the supermarkets, the meal deals, the 2 you get, I wouldn't be able to finish a whole one of those. I could probably eat 1 of them, and very slowly. But that's great, because then you look at the calories on that, and it's usually you're halving it. And most sandwiches have 500 to 600 calories. I'm getting usually the healthier ones now, which tend to have 200 or 300. But then you half that, because you're only eating 1 part of the sandwich, and that's all you're getting. So I am quite conscious now about the calories, the kcals that I put in my body. Trying to understand the calorie deficit I need, the energy being consumed versus the energy being burned, and that's getting that into a negative balance means that I'm losing weight. I think 3,500 calories is equivalent to a pound. So over 2 or 3 days, if you create a big enough calorie deficit, you're losing your weight. And your reduced stomach from having the gastric sleeve allows you to do that. I feel much fuller and satisfied when I eat a meal now, sooner than I would have ever done, and I don't feel hungry as often. I'm not in any pain now. There wasn't a significant amount of pain anyway. It was more discomfort, but certainly 6-7 weeks after the operation, I'm not aware that I've had an operation other than the visible scars on my stomach. Because I've lost nearly 3 stone now, I am getting a lot more energy back. I don't feel as tired as lethargic as I used to. I used to have afternoon naps all the time, or feel myself snoozing off in the afternoon. Doesn't happen now, so I'm going for walks in the evening. I could swim anyway, but I'm enjoying swimming. It's a low impact sport for someone of my size. So the more weight loss I lose, the more energy I get, the more I can exercise, meaning I can lose more weight. So it's a combination of having that good diet, sensible diet, and getting a new lease of life and being more energetic. So it's coming slowly, but I didn't want it to be fast. I wanted it to be sort of a slow, methodical process that I was comfortable with. So for me, the whole process has been overwhelmingly positive. I don't have any regrets. It's something that I would recommend to anyone if they had serious issues with their weight, if they're struggling and they want a long-term solution. For me, the gastric sleeve out of the 3 options was the most appropriate. It may not be the most appropriate for you, but I'm only giving you my experiences. The surgery, there's parts of it that are uncomfortable, but it's very, very temporary. I was in hospital for less than 72 hours. I've had 6 weeks since then, and you know, when you're in hospital, they do look after you, and you have to only think that within a few weeks of being out of hospital, you're going to be back to doing your normal job, your normal life, and the weight loss is coming. I got into a habit of weighing myself every day, which is really bad because your weight does fluctuate, and sometimes you go up, sometimes you go down, and you get really angry if you've gone up. So I try and keep it as disparate as I can, so maybe every 3 or 4 days. It should be once a week. But I'm seeing my dietitian again next month in August, and I'm sure by that point I will be well over 3, probably 3.5 stone lighter, so I'm sure she'll be pleased with that. And long may it continue. You know, this has been a really positive step in my life, hopefully has prolonged my life, certainly improved the quality of my life, and it's positive to hear when other people say that know you've really lost weight. It's wonderful to hear. I don't ever get bored of saying it. Some people are a bit more reserved about saying it. I think that's part of being English. They don't like to comment on someone's personal appearance, but if I prompt them or cue them, they will say, well, I can see that, you know, particularly in my face, I don't have the jowls I once had here, and that really encourages you and spurs you on as well when other people who are close to you say it looks good, keep it up. So it's something that like I say, I don't regret. I'm really pleased I had the operation. It's something that I'm glad I didn't rush into. I did a lot of research, which is one of the reasons I wanted to put this video out there, to give you my experience and hopefully the benefit of my experience. But I hope you make a decision that works for you, and I wish you well on your weight loss journey, and perhaps I'll post another video in 6 months and let you know how I've got on around the end of the year. So thanks for watching, and I wish you well. Thank you.